Hello everybody and welcome to the Thursday edition of Video Clips. And just a reminder, we have some wonderful package offers for fall. A food over medicine coaching program combined with diet and lifestyle intervention course, food over medicine with some certification courses, diet lifestyle with some certification courses. So if you want information on this or to set up a time to talk to me, pampopper@msn.com is my email address, so feel free to write to me and we'll set up something and talk about what your goals and aspirations are and how we might be able to help you get there. All right, so two topics that are somewhat related today. I want to start with benzodiazepines, which I've talked about frequently over the years. Could benzodiazepines be the next public health crisis? Well, according to some officials, the answer is yes. Drugs in this class like Klonopin, Valium, Ativan, and Xanax are prescribed for many different conditions, mostly anxiety and sleep disorders. Millions of Americans are taking them. Prescriptions for American adults increased by 67% between 1996 and 2013. Now, here's the thing that's really disturbing. The National Institute on Drug Abuse reports that benzos are increasing overdose deaths from opioids since doctors often prescribe both drugs together. In fact, over 30% of opioid overdoses involve benzos, more than both cocaine and methamphetamines combined. Overdoses involving benzos increased by 400% between 2002 and 2015. Both opioids and benzodiazepines induce sedation, they suppress breathing, they impair cognitive function, and all of these things can increase the risk of overdose death. In one cohort study, the death rate from overdose was 10 times higher in patients who took both of these types of drugs than for those only taking opioids. The Centers for Disease Control issued new guidelines in 2016 recommending that doctors avoid prescribing both drugs at the same time, and both drugs carry black box warnings telling people don't take them at the same time. A major impediment to reducing the risk of overdose is that withdrawing from benzodiazepines can be extremely difficult. Stopping suddenly and without a careful taper can result in seizures and even death. Doctors often do not know how to withdraw patients safely and advise them to taper their doses off way too quickly. And that's a major problem that we have with benzos and all the psych drugs. Really good at prescribing them, not so good at helping people withdraw. Concerned health professionals compare the over-prescribing of benzos today to the beginning of the opioid epidemic in the early 1990s, and the similarities are indeed, I think, quite scary. Doctors believed at the time that opioids were safe, and they were falsely reassured by drug companies that patients would not become addicted. Today, both doctors and patients believe that benzodiazepines are safe and are generally unaware of how quickly people can become psychologically and physically dependent on them. According to Dr. Christy Huff, co-director of the Benzodiazepine Information Coalition, quote, "The medication should be prescribed for no more than 2 to 4 weeks. They were always meant to be short-term." And I find that interesting because we have so many members who've been taking benzodiazepines sometimes for years at a time. The problem is so serious that some states are starting to pass laws limiting the duration of prescriptions. Most states now require doctors and pharmacists to track opioid prescribing, but benzodiazepines are not tracked in half of all states, and this, I think, needs to change right away. A few institutions have announced changes in prescribing practices. So, for example, community mental health centers in Louisville have stopped prescribing benzos at all. Xanax is off the list because it's commonly abused and extremely dangerous when taken with alcohol and/or opioids. But more change is needed quickly in order to address what is becoming an even bigger public health crisis. A good argument can be made that benzodiazepines should never be prescribed and that there are better alternatives for treating anxiety. Take exercise, for example. According to a recent meta-analysis, aerobic exercise can reduce anxiety, and higher intensity exercise has a greater effect on anxiety reduction than lower intensity exercise. Many studies have shown similar results, and I think this particular paper has 11 references, several of them on exercise. Exercise can also be a very important tool in helping people to withdraw from both opioids and benzodiazepines. It's been shown to help in addiction recovery, regardless of the stage of addiction of the patient or the substance to which the person has become addicted. This crisis is really due, this whole opioid crisis, the psych drug crisis, a lot of it is due to the fact that the medical profession just can't seem to restrain itself. Doctors continue to overprescribe many, if not most, drugs ranging from antibiotics to antipsychotics. The only way to stop this may be to pass laws that dictate prescribing parameters. This would not be the first time, by the way, that external regulation has been necessary in order to reduce medical excess. For example, in the 1970s, it became apparent that doctors would fill as many beds as were built in any geographic area in terms of hospital development, and that led states to start requiring certificates of need in order to justify building new hospitals. They literally would fill up as many buildings with as many beds as you could build. Now, I think there are a lot of excellent doctors, and when I indict the profession, I want to exempt the people that I think really work to try to do the same thing, the right thing. But the medical profession as a whole just does not seem to be able to self-regulate. And of course, I'm the person who's usually talking about less rather than more government, but in this case, government may actually be the only solution to the problem, and the certificates of need is the only reason why we probably don't have 25 more hospitals in Franklin County where I live than we have right now. Related to that, why are opioids prescribed in the first place? Pain. A lot of times that's how it all begins. And pain is often due to a lot of factors that can be resolved, like being overweight, eating a diet high in animal foods and fat, misalignment of the spine and joints. But some pain is unavoidable, for example, pain from injuries and dental procedures and surgery. Fortunately, more and more people are becoming aware of the dangerous side effects of nonsteroidal anti-inflammatory drugs, which include the risk of heart attack and stroke and atrial fibrillation. And fortunately, there's so much publicity about the opioid drugs, I'm hoping that people are deciding that that's not such a good plan either. Now, it's impossible to avoid the use of all pharmaceutical pain relievers, but there are natural alternatives, and one of them is bromelain. And it's effective for relieving some forms of pain. So I had seen studies here and there and finally decided to sit down and write a paper and look into all of the evidence about bromelain. So here's what I found. First of all, just by way of what it is, bromelain is one of several protein-digesting enzymes which is found in the fruit and the stem of pineapple. Bromelain found in the fruit is different than the stuff that's found in the stem, and it's generally the bromelain from the stem that is used to make supplements that are used for therapy, such as for pain relief. It's very expensive to make because the stem is really considered a waste product of the pineapple that would have no sale value anyway. A few studies have shown that bromelain is effective for pain relief for conditions like arthritis and even for moderate to severe rheumatoid arthritis. It can reduce the number of days required for resolution of pain and inflammation after surgery. For example, a combination of bromelain, trypsin, and rutin given to patients for 2 weeks following surgery to repair fractured bones resulted in a reduction in post-operative swelling and less pain medication. That same combination was used in another study that involved 103 patients who had osteoarthritis of the knee. They were randomized to either take that supplement combo or an NSAID. The researchers reported that the bromelain combination was as effective and as very safe alternative to the NSAID for treatment of pain associated with osteoarthritis of the knee. Other studies have confirmed the fact that bromelain is similar to the effect of NSAIDs for osteoarthritis. One study showed that taking 90 milligrams of bromelain 3 times a day was as effective as taking 50 milligrams of an NSAID twice per day for relief of osteoarthritis of the knee. Patients in both groups reported reductions in joint pain and swelling and improvement in range of motion. What I found interesting about this study is that the researchers reported that for some measures, bromelain actually worked better than the NSAID, and those included improvement in symptoms of pain at rest and improved function. Another study showed that bromelain had a dose-dependent effect on patients with mild acute knee pain. Patients improved more while taking 400 milligrams a day versus 200 milligrams a day. And a dose-dependent effect strengthens the relationship, in my opinion. Bromelain's been shown to be helpful for reducing pain after dental procedures. In one study, 45 patients who had a single implanted wisdom tooth removed under anesthesia were randomized to take 250 milligrams of bromelain 4 times a day, 25 milligrams of an NSAID 4 times a day, or placebo 4 times a day for 4 days after they had the procedure. There was a significant reduction in pain for both the NSAID and the bromelain group as opposed to the placebo. Not surprisingly, based on what I've been telling you, bromelain can also be used to reduce exercise-induced muscle damage and inflammation and to reduce sports-related fatigue. It's also been shown to improve recovery time for athletes. The mechanism of action is thought to be the effect of bromelain on pain mediators like bradykinin. There are varying options or opinions about dosing. The usual range in the studies that I looked at was someplace between 80 and 320 milligrams taken 2 to 4 times a day. People who are allergic to pineapple shouldn't take it. It should also not be used while taking drugs that increase the risk of bleeding episodes like NSAIDs and blood thinners. And there is some evidence that it can increase the absorption of some antibiotics. But all in all, very low risk and really good benefit as far as I can see, and much safer than taking drugs. I think it's best to consult with a health professional who's familiar with the use of bromelain and its interactions with other supplements and drugs, as well as the right type of therapeutic dose for the purpose that you would be using it for, because recovery from a dental surgery is different than acute pain from an injury, which is different from chronic pain from arthritis. So I think it's good to consult with somebody who knows a little bit about this type of thing. So all in all, we have a crisis with opioids and benzos. We could use other things besides opioids for pain, and we should try to do that in any time we can. In fact, anytime we can avoid any type of pharmaceutical drug, I think it's a good idea to do so. They're always there when you need them, and sometimes people definitely need them. I have taken them too, but no question we overprescribe and we hurt people when we do that. All right, that's all for today, and actually all for the week. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news.